When we are thinking about breastfeeding through IVF treatment, there are often three main concerns. 1. Will breastfeeding affect my chances? What is the effect of breastfeeding on fertility? 2. Will the medication affect my breastfeeding child or my supply? Do I need to wean? And 3. Will my clinic even treat me whilst breastfeeding? So, in relation to will breastfeeding affect my chances of success? Firstly, there is no real evidence either way. However, what we do know is that it is possible for individuals to become pregnant whilst breastfeeding, and a number do go on to tandem feed. The Facebook page and support group Breastfeeding During IVF Treatment also has a large number of success stories that those undergoing treatment can access. Whilst in the early months postpartum, individuals may find that breastfeeding has a suppressing effect due to the hormone prolactin, this generally returns to normal levels at around 12 months. Treatment isn't generally advised prior to this. It isn't always necessary either to have had a period when having treatment, as this is often a concern. Whilst undergoing treatment, there may be a number of medications that are prescribed. Often, the biggest concern is whether these are safe. The Breastfeeding Network here in the UK has an extensive resource relating to medications that may be used for a variety of reasons, and these can be checked to see what are the risks of taking those medications. There are very few that are contraindicated, i.e. most likely not safe. But often these will have alternatives, and again the evidence for these is mixed. It is always advisable to research the medications when undergoing treatment. Whilst many medications are not contraindicated, there is a risk to supply with any medication, although this is largely individual. It is for this reason that treatment before 12 months is generally not advised, as baby is reliant on milk for nutrition up until this point. In terms of will my clinic treat me, we must remember that fertility consultants are not lactation specialists and have very little scientific evidence to draw upon. Some have a strict no breastfeeding policy. In these cases, it may be possible to seek treatment elsewhere. Again, the Breastfeeding During IVF Treatment group maintains a file on the breastfeeding friendly status of clinics worldwide. You may find that some consultants are willing to discuss treatment whilst breastfeeding, and it is useful to be prepared with the evidence for resources such as the Breastfeeding During IVF Treatment group or the Breastfeeding Network. These may be more tolerant, but expect you to bear the responsibility of making a decision either way. However, more and more clinics are becoming breastfeeding friendly and will be happy to treat you, especially if they had a positive experience of treating a breastfeeding mother in the past. So, whilst there are things to consider, it is absolutely possible to breastfeed whilst undergoing fertility treatment.